Our final speaker this afternoon has been working with the Yamhill CCO and our community partners as a consultant to develop our strategy for creating a more nurturing and resilient community. Dr. Biglin is a senior scientist at Oregon Research Institute and the co-director of the Promise Neighborhood Research Consortium. He has been conducting research on the development and prevention of child and adolescent problem behavior for the past 30 years. His work has included studies of the risk and protective factors associated with tobacco, alcohol, and other drug use, high-risk sexual behavior, and antisocial behavior. He has conducted numerous experimental evaluations of interventions to prevent tobacco use, both through school-based programs and community-wide interventions. And he has evaluated interventions to prevent high-risk sexual behavior, antisocial behavior, and reading failure. In recent years, Dr. Biglin's work has shifted to a more comprehensive interventions that have the potential to prevent the entire range of child and adolescent problems. He and colleagues at the Center for Advanced Study in the Behavioral Sciences published a book summarizing the epidemiology, cost, etiology, prevention, and treatment of youth with multiple problems. He is a former president of the Society for Prevention Research. He was a member of the Institute of Medicine Committee on Prevention. As a member of Oregon's Alcohol and Drug Policy Commission, he has helped to develop a strategic plan for implementing comprehensive evidence-based interventions throughout Oregon. So please join me in welcoming Dr. Anthony Biglin.
Some technical difficulties we're going to try out here. I made a video about there's a book over there that I published this year called The Nurture Effect, and I made a video which sort of summarizes everything I have to say in 3 minutes, but we don't think we can get the video working, so let's give it a try. Nope, we haven't got enough sound. So, if you go to my website, thenurtureeffect.com, you can find the video and see it. It's about 3 minutes, and it'll tell you everything you need to know about prevention. So let me start by saying let's go on to here. I love Yamhill County. I always kind of thought Yamhill County was a little different, and I sort of thought, from a distance. But as I have gotten to know what you are doing in a state which is already way ahead of the other states in terms of what it's doing to try and improve human well-being, as I've seen what you are up to, I think you are on the cutting edge in this country. And I'm speaking as somebody I'm speaking all over the country to communities and groups about what they're doing, and you guys rock. So there's a what we call the prevention metaphor. Imagine your community's next to a river. And one day there are a couple kids flailing along in the river, floating down the river, and somebody tries to catch them, and you catch one of them, the other one drowns. And the next day there are 3 more kids, and you save 2 of them. And pretty soon, your emergency responders are there next to the river waiting for the kids to come floating down, and you're getting better and better at saving the kids, right? But nobody ever goes upstream to see where all these kids are coming from. That's what prevention is about. It's going upstream and trying to deal with the things that lead to these problems so you can prevent them. Most of what you've talked about today has to do with the trauma that people experience. And I always talk about that and talk about it in some detail. I'm going to talk a little less about it because you've already been told a lot about that. But before I get to that, let me just say that science has changed our world. I'd like you to think about what it was like 150 years ago and how much science has changed our physical world and our physical health. 150 years ago, it took 2.5 months to get from New York City to San Francisco. Now, you can do it even on United Airlines in about 6 hours, right? And 150 years ago, it took about a month to get a letter just from Utah to California. Now you can talk to anyone in the world and see them at no cost whatsoever. And then the other example, which is in the video and you didn't see, is John Snow and cholera epidemics. John Snow was a surgeon in London, England, which was the largest and wealthiest community in the world at the time. In the 1850s, people were dying of cholera epidemics routinely in London and all over England. And there were all kinds of theories about what caused it. And John Snow believed that it was contaminated water, which was not what most people believed. So there was an outbreak, and I think I have, yes, there was an outbreak of cholera in the Soho neighborhood. This is a map of the Soho neighborhood. And John Snow and a local minister went around to every building, and they determined how many people had died. And every one of these black marks is a death. And so you can see that there are a bunch of deaths here and here, and there's a pump here, there's a pump here, and there's a pump here. That's where people got their drinking water. This, by the way, was a brewery. There were no deaths there. Guess what they were drinking? But they saw that they were clustered around the Broad Street pump. And so he got the town fathers and mothers to remove the pump handle, and the epidemic ended. There were about 5,000 people who died, and it ended. And I've got a graph in that video that shows that about 100,000 people had died up to 1850 in England due to cholera, and it had all over the world. And cholera was just wiped out in England, and increasingly in other countries as they got clear that it was contaminated water and they needed to deal with that. And today, if you found that somebody was putting raw sewage into the river, how long would that last? All you'd have to do is call the authorities and that would end. Because the science has taught us what we need. And I want to submit that the science that has been developed around how human behavior works and what we can do to prevent these problems is at a point where if we take what we know and we actually put it in places like Yamhill County, that you can achieve lower levels of drug abuse, smoking, cardiovascular disease, depression, all of these kinds of problems, lower levels than have ever been seen in human history. We aren't there yet, but you're on the way to doing that. So this is a vision of what we've learned about prevention that's from the Institute of Medicine report that was issued in 2009. I was on the committee. And basically what we concluded after we looked at all the preventive interventions is that we have the knowledge to ensure that virtually every young person, if we can figure out how to put this stuff in the real world, that we have the knowledge to ensure that virtually every young person arrives at adulthood with the skills, interests, health habits, and values they need to live a productive life in caring relationships with other people. And I want to come back to caring relationships with other people. So that's the vision, and this is a summary. This is from the Institute of Medicine report as well, and it shows, that slide could come over just a little bit. But anyway, these are developmental phases. And these are, all of these bracketed items are interventions that have been shown to have benefit in preventing problems. Most of them have been shown to prevent multiple problems. Might start out to prevent drug abuse, but it turns out you improve academic performance and prevent many other problems. There are home visiting programs and early childhood interventions and parenting skills training programs and social and behavioral skills training and classroom-based curricula and prevention programs for depression and prevention programs for schizophrenia and even prevention focused on specific family adversities like there's a divorce or a death in the family. There are interventions that have been shown in randomized trials to improve outcomes for families, the kids and the parents. And there are even community interventions where whole communities are get a program or don't. We did one in Oregon in 16 communities where 8 of them got a comprehensive tobacco prevention program, and we had significantly lower rates of smoking among the kids in the communities that got that. And there are also policies that are available. We have a rich set of things that can be done, but I'm standing up here bragging about all the stuff we know, but I have to say that exactly how we translate that into working in every community, we're still working on, and we have to work on that collectively, because I don't know the answers to that. In many ways you do, but I would love to collaborate with you in moving forward on these kinds of things. So nurturing environments. What I came to after I was on this IOM report was that there are 4 basic things that are involved in every one of these preventive interventions. And the first one is that they minimize toxic social and biological conditions. I won't say much about biological conditions, but how many people are taking omega-3 supplements? Okay, then it's good that I came, because you should be taking omega-3 supplements, because omega-6, if you read the ingredients in any processed food, most of them you will find are full of soy oil. Soy oil is high in omega-6. Omega-6 replaces omega-3. Omega-3 is what human beings evolved eating for up until about the last 50 years. But now there's so much omega-6 that the omega-3 levels are down. That leads to inflammatory processes in the brain that are associated with depression, aggression, and obesity, and ultimately cardiovascular disease. So you should be taking your omega-3. But I also want to talk about the toxic social conditions, because most of the trauma that we've been talking about today is trauma that is the result of human interactions. And if we can figure out how to help people move from coercive, conflict-filled interactions to more caring, respectful, and patient interactions, that's at the root of most of what you're doing. You're working with families that have been abusing. And what are you doing? Are you shaking your fist at the abusing parent? I don't think so. You're joining them. The judge, who is still here, I believe, I was so touched by what you're talking about, because I'm listening to you in the context of what seems to be a movement that is starting nationwide that realizes that we we've long known we have the highest rate of incarceration of any country in the world, the highest rate in any country in the world, and it's harmful to the people who are incarcerated. It's harmful to the people whose families are hurt by these kinds of incarcerations. And to listen to you get it that we need to care for people and respect them and hold and reach out to them, as you talked about it, was just very touching to me. And that's exactly what we need to do. We need to step over the aversive behavior of people and find ways to care for them and help them move forward. And every one of the interventions I'm going to describe does basically that. The second thing about nurturing environments is that we teach, promote, and richly reinforce pro-social behavior. And by pro-social behavior, I mean all of the things that you're doing, all of the things that you would have your kids do to care for each other, to care for people, to do things in your community. The values, the key values are communitarian values. I want to grow as a person, I want to help others, I want to give to my community. And there's a wealth of evidence that when people adopt those kinds of values, that they engage in much more helpful behavior. And countries that have high levels of those kinds of communitarian values even have lower levels of child maltreatment and in fact lower carbon footprint. And I'm not talking about reinforcement as just M&Ms and stickers. I'm talking about listening and caring and touching and smiling and recognizing and thanking and those kinds of things. That's what we need to replace the toxic social conditions with, and that's what all of these interventions do. The third thing is we need to limit influences and opportunities for problem behavior. Influences like the marketing of tobacco and alcohol, which is very carefully done to convince young people that if they drink or if they smoke, that they will be popular, they will be accepted, that they will be exciting. I should have brought, we're doing an alcohol prevention program which we're offering to high schools here in Yamhill County. We haven't worked that out, but I've got these 8.5 by 11 ads, and there's this really sexy woman and the beer, and I'm going, there isn't a 17-year-old boy who'd have any interest in looking at that, right? I mean, the marketing is very skillful. I know, I was an expert witness in U.S. versus Philip Morris et al. And the fourth thing is to promote psychological flexibility, which is a mindful approach to pursuing one's values. And I'm going to talk a little bit more about that. But first, a couple things. I had a conversation with Jordan Robinson the other day, and we were talking about the importance of getting everybody, especially people who are in the healthcare area, to understand the degree to which the kinds of things that you're dealing with in abuse and trauma are things that contribute to the illnesses that we're dealing with. There is evidence that when adults who have a history of maltreatment they're about 2 3/4 times more likely to have a stroke or myocardial infarction. Somehow, trauma gets under the skin and causes inflammatory processes that lead to death at an earlier age. There's research showing that poverty in childhood leads to adults having a 20 to 40% increased risk of all-cause mortality, 30 to 60% increased risk of cardiovascular disease, and the effects are seen even among people who've escaped from poverty, and you match them to people who were never in poverty, and they still have a higher rate of cardiovascular disease. And the only exception is if they say their mother was nurturing, then that effect goes away, which I think points to the fact that the way that poverty affects people is that it causes more stressful family environments that lead to these kinds of problems. And so here we have Yamhill County, and these are the two major causes of death are cancer and heart disease. And these are the very things that are affected by trauma. And so if you're not interested in preventing smoking and all of those kinds of things, but you just want people to not have heart attacks, you should care about preventing trauma and preventing smoking and all of those things, because they really contribute to deaths. This is a graph by Greg Miller, and it's just pointing out that even mild kinds of aversive behavior of parents cause epigenetic changes and inflammatory processes that lead to heart disease and tumor growth and family and frailty. So the one thing I do want to say about this is that we have to get down to the way in which this stuff gets under the skin. And the reason that it happens is that conflict in families tends to have a life of its own, and it tends to have a life of its own because of a process that's been called coercion. Aggressive social behavior. There are studies that have been done where they went into families of aggressive kids and they looked at the interactions, and they discovered that if a person in a family with aggressive kids engages in aversive behavior of others, they get other people to back off. For example, mom says, "It's time to go to bed." And Johnny says, "I don't want to go to bed." And so mom backs off. She doesn't say anything more, right? Well, what just happened? Well, he got reinforced for being nasty because she backed off. She got reinforced for backing off because he stopped mouthing off, right? In families with aggressive kids, in families that have high levels of conflict, this is the way people have learned to deal with each other. And many of them have learned that because they're hypervigilant because of histories of trauma themselves. But they're quick to see threat where other people wouldn't see it, and they're quick to react with negativity, which leads other people to act with negativity. And the family interventions that I'm going to mention are ones that help families to abandon this kind of interaction and to develop more respectful, caring, and positively reinforcing interactions. The same is true with marital discord. Exactly the same processes are involved. And we even did a study with women who were depressed and found that in depression, one of the things that motivates people to act in sad and depressed ways is that other people back off. They're just a little less likely to be nasty and critical when you're sad. Nobody's having a good time, but that's one of the ways in which depression gets maintained. And when you do marital interventions that help couples to become more caring toward each other, depression goes away even if you don't directly treat it. So this is the HPA axis, and there's a wonderful book by Robert Sapolsky called Why Zebras Don't Get Ulcers. It's the second funniest science book you'll ever read. His Primates Memoir is the funniest. So this is how it works. A stressor is seen. The zebra sees a lion. And then there's a cascade of hormones that results in cortisol being released, which increases heart rate, increases blood pressure, and enables that zebra to run like hell, right? And if the zebra is fortunate enough to have an older, slower zebra nearby, zebra gets away, right? Gets into the woods, it's over, right? What happens? Well, the stimulus is gone, the cortisol's reabsorbed, the heart rate goes down, the blood pressure goes down, it's over, right? So why do you suppose zebras don't get ulcers? And humans do. Well, okay, do this. Raise your hand if you've ever found yourself lying in bed stressing about another person who was not lying next to you. right? It's the human condition. Humans, because of our verbal ability, can talk about and think about and stress about and obsess about things that are troubling to them, and very often those things are other people, right? And so keep that in mind when I come to the mindfulness stuff. So this is a picture of my son and his son, because that's a more appealing thing, because when I look at this, I say, well, you can't hug an HPA axis, but in the end, everybody needs this. They need warmth, they need sick caring, they need safety. The person who sells you things in the grocery store, the person you're working with, the person who works with you. Laura this morning described so beautifully the kinds of things that you're experiencing, and all of it can be helped by deep breath, caring for the person next to you, and caring for yourself as well. So this is a list of some of the family interventions that are available and the developmental phases that are available. And so I'll talk about a few of these, but this is just to say that there are a whole bunch of things that are available, including the Incredible Years, which you're already implementing, which is a good program. We evaluated in an intervention, and there have been a lot of studies of it. And this is evidence-based school interventions affecting social, behavioral, and academic outcomes. And I put these stars in while I was sitting listening to the panel discussion, because these are ones that I think you might do well to consider adding to your repertoire of things you're doing. This is professional development for preschool providers, and there's a good study showing that you can help improve the quality of preschools by helping parents or helping preschool providers to get training in essentially the skills of joining the child in a good way, and helping that child to learn more. There's more conversation and so on. Really nice results. And there are a variety of other programs. Are you doing the Nurse-Family Partnership at all? Okay. But you are doing home visitation. So let me talk about this. You might consider this program, but in any case, I think that the characteristics of it are important to talk about. This is a program for pregnancy through infancy, and it focuses on getting good prenatal care, maternal smoking, reducing maternal smoking, which, by the way, there are some good programs to do that. So if you want any help on that, there are some programs that have proven benefit in helping mothers to quit smoking, which is a huge risk factor for kids. Improving mothering once the baby is born, improving contraception and work life. And this program has been evaluated in 3 randomized trials over 25 years. It reduces abuse and neglect, children's behavioral development, mother's economic well-being, time to the next baby, and children's arrests as adolescents. But the thing I want to emphasize about this is that it's a good model of, okay, so a young woman, let's say she's a teenager, she's single, she's pregnant, her parents are angry at her, her boyfriend says, it wasn't mine, and she doesn't like him anyway, she don't want to be married to him. And now comes a nurse who joins that woman, and maybe is the only person in that woman's life at the moment who is listening to them and caring for them and helping her to get clear on where she wants to go. And they immediately start talking to her about, okay, so what do you want in your life? What do you want in your future? And they help her to start planning. And maybe she's never thought about what she wants in her life, but they start to help her plan her future and her education and what she wants to do. And they've now done this with 200,000 people around the country. And if this is one woman, she's actually a recipient of the Nurse-Family Partnership. If you go to the website, there are stories about the people. But the point I want to make here is that joining of people in a caring way can be so powerful. And that's what, to the extent that you're doing that, you're doing well. And by the way, here is the impact of the Nurse-Family Partnership on arrest rates in the first study in Elmira. The kids at age 15, 35% of the kids who didn't get this program were arrested for delinquency, and it was half that, less than half that, in the ones that got the Nurse-Family Partnership. If you could reduce the delinquency rate in your community by 50%, worth trying, yeah? Because don't forget, you prevent any of these things, and you're preventing all kinds of trauma down the road, right? Well, here by the way, are thanks to Becca. Where's Becca? She sent me these figures, and these are the juvenile referral rates in both Oregon and in Yamhill County. The blue is Yamhill County. And as you can see, as in most of the country, it's gone down quite a bit. But it's still, what is it, 25 per 100,000? There's still room to improve, and you can do that. Then there's the Positive Parenting Program. These parenting programs developed out of I'm not going fast enough. What to do? The parenting programs were originally clinical programs. Your kid's out of control, we'll do 12 sessions, and so on. But as Silas was talking on the panel discussion, the real challenge is to see if you can affect an entire population. Well, if the proposition is that you're going to find the families that need this and reach out to them and get them all to come to a 12-session program, good luck. Seamus hasn't got the money to do that, right? But this program is designed to reach people with little bits of help and at key times. So they've created, for example, 40 tip sheets that are for the most common problems of early childhood. You can't get your kid to go to a store without tantruming. Here's a tip sheet on how you can do that. And it helps parents to develop the skills and avoid problems that could escalate into lifelong problems with the child. And that program was tested in South Carolina. They had 18 counties, and 9 of them were randomly assigned to get Triple P, this public health approach, and the other 9 didn't get it. And they trained about 600 people in the counties that get it to just give advice and brief help, and if necessary, more intensive help. And what they found was that child abuse was going up in the control counties, like so, and it was also going up in the counties that weren't in the study in South Carolina, but there was no increase in the counties that were getting Triple P. It was a big effect, and it reduced hospital-reported child abuse, and it also reduced foster care placement, which is an expensive and not necessarily good thing for people. Then there's the Mac Choice program. This is a project that we developed. Mac Choice stands for Monogamy, Abstinence, and Condoms. We did this program in 3 sexually transmitted disease clinics in Oregon, and we found that young women who got this program, we helped them to develop more monogamous relationships, to reduce involvement with non-monogamous partners, and to have fewer sexual contacts with strangers. So this is a program that I was sitting next to someone whose name I've forgotten, but I sent her the paper, and we can help with that if you're interested. And then there's Richly Reinforced Pro-Social Behaviors. The Incredible Years is a program that the Lutheran Family Services is doing. It's a good program. I've talked a little bit about that. The point I wanted to make here is that what it helps parents do is get better at listening to their child, following their child's lead, giving fewer commands, and being more reinforcing, not in praise and stickers, though those are good and work if they're needed, but just by following the child's lead and playing with the child and listening to the child, you can have a big impact. And the benefits are increased parental positive affect, increased effective parental limit setting, replacing spanking and harsh discipline with nonviolent discipline techniques, reduction in parental depression, increases in parental self-confidence, increases in positive family communication, and reduced conduct problems in children's interactions with parents, and increases in positive affect. So this is a pretty good program. It's one example, and people who are skilled in this or probably would be good candidates to help with something like Triple P if you wanted to try and reach out to the whole population. Then there's the Good Behavior Game. This is one of my favorites, and this is one that I think you do well to consider. So the way the Good Behavior Game works is it's played in elementary schools. And so just today, this will be the green team, and this will be the blue team. And you're just going to play it today for 10 minutes. Eventually, we'll have it for, like an hour, 2 hours, even all day. So if you're on task and you're not doing this to your neighbor the way you were yesterday, you can get a reward, right? That's what we call a spleen. If you have 3 or fewer spleens, you can win. But so can you, right? There's 1. 1 apiece. And if you have 3 or fewer, you can win, okay? So my friend Dennis Embry, who is implementing this program in Estonia, Sweden, Ireland, Manitoba, and all of United States, districts all over he sends me this video from Manitoba. And there's this little kid right in the middle of the picture, and he's in first grade, and they just got their reward, and he's so excited. So what's the reward? Well, the teacher goes to the timer, and she sets it for 10 seconds, and the kids can laugh uproariously for 10 seconds, right? By the way, both teams can win, right? A friend of mine, Shep Kellum, did a randomized trial of this in inner city Baltimore, and he followed these kids into adulthood. These are kids who got the good behavior game or didn't get it in first and second grade in high poverty neighborhoods. In the first month, they had more time on teaching and learning. Any teachers here? How would you like to have an extra week of instructional time because kids move from one activity to another quickly because you're not having to stop and deal with behavior? Teachers love this. It takes a thorn out of their paw. Less stress for staff and students. In the first year, better attendance, fewer referrals, fewer service needs, less illness, happier families, less vandalism, better academics. Sound reasonable? By middle school, there was less ADHD and oppositional defiant disorder, less special education needed. Oh, that was 2 to 3 years later. By middle school, less smoking, less alcohol use, fewer conduct disorders, less depression, and in adulthood, there was less crime, violence, suicide, drug abuse, high school graduation was higher, and university attendance was higher. All in first and second grade. Why? Because it helped kids to develop cooperation and self-regulation, the ability to not immediately do the impulsive thing, which is fundamental to the success of kids. And there's pre-reading and reading skills. That we did a study of supplemental instruction and decoding and fluency skills with both Hispanic and non-Hispanic kids, and we found that 2 years after the program had ended, and these are kids in K through 3, 2 years after the program had ended, the kids who got this program had better decoding skills and better comprehension. And so this is a program that's well worth considering, which is why I got those stars here. And there's also a program to help Hispanic parents nurture their children's reading skill, which I just learned about yesterday, and I can tell you more about that if you're interested. Then there's cooperative learning. Middle school is an important place where problems start to go up in frequency, and a successful transition in middle school can position a child for sustained success. Unsuccessful, it leads to the development of numerous problems. Cooperative learning can address many of the challenges that children face during that transition, because cooperative learning essentially does what the good behavior game does, but at a middle school level, and helps kids to learn to cooperate and work together and work as a team. And if teams are achieving things, that reinforces the cooperation of all the people. And by the way, how many of you work by yourself and never interact with anybody else? Right? I mean, a trained workforce should be able to read, but they should also be able to cooperate with other people. This is important. The third is the limit influences and opportunities for problem behavior. I've talked enough about this, but I'll give you one example. The Family Checkup is a program that has 3 sessions for middle school kids and families, and it reaches out to families without any stigma. You can get it, everybody needs a checkup, right? So families are invited to have a checkup, and in the first session, the parent consultant just gets clear on what the strengths of the family are and what concerns are. Then they'll do a home visit and get more information about how the family interacts. And by the third session, they simply give feedback and advice about what they can do. Very simple program. The effects have been seen as much as 5 years later. There was a randomized trial of this in Portland, Oregon, that showed that there was reduced, well, here's this is the drug abuse rates for the kids who didn't get that program in 9th grade. They only got it in 6th and 7th grade. And as you can see, much less substance abuse in the kids who got the program. Similarly, the delinquency rates, 61% for the controls and 38% for the intervention. So this is a program that's well worth considering for middle schools. Then there's positive intervention, behavioral intervention and support, which is being implemented, I believe, in most of the schools. I know in McMinnville, but I think in the other districts as well. So what I'll simply say here is that the out-of-school suspensions have declined every year since the schools have been adopting positive behavior intervention support. It's just a system for setting up a school with a small number of rules, and then a lot of reinforcement for adhering to those rules. Then there's a mindful approach to living a valued life. And this doesn't come out of prevention as much as it comes out of clinical research. The concept here is psychological flexibility. And I have to say that I started learning about this in the mid-'80s, and it has changed my life, and it has changed my orientation to things. And over the past 15 years, there have been more than 100 randomized trials of what's called acceptance and commitment therapy. And basically, basically what that does is it helps people to become what's called psychologically flexible. What does that mean? Well, the first thing is that it helps people to become more aware of the things that are going on in themselves and around them. It's mindfulness, right? It may be facilitated by meditation. It may be facilitated by just helping people to stop and notice where you are and what you're doing and what's going on. The more you're aware of what's going on, the better you have the flexibility to do what will work for you. The second aspect of it is to help people to be open. And Laura gave some excellent examples of just kind of noticing, oh, I'm here, I'm standing here, I'm worried that I'm not going to get done on time. Oh, you know, that's there for me. That can be there for me. And what it helps, remember when we were saying you're lying in bed and you're thinking about things? Okay, here's why this is relevant. Because you can get to the point where you can have those thoughts and feelings. And you know, I mean, I used to think, well, I got to stop them. And I got to do, you know, there was a program that used to be, you put a rubber band around your wrist, and whenever you have a thought you don't like, you pull it and, you know, punish yourself. Honest to God, this was back in the 70s, this was a program. I even tried it. Didn't work for me, anyway. What this is accepting the thoughts and feelings you have without trying to change them, without struggling with them, but just accepting that human beings have those thoughts. If I had a microphone on every one of you, and we could amplify what you were saying, there'd be so much chatter. It's like that movie Jim Carrey is God for, you know, a week, and he's hearing all the, you know, it would be like that. Human beings are constantly chattering. And but the problem is that so often we listen to ourselves like our mind is right, you know? Well, minds can be right, they can be wrong. This allows you to just be open to what's there without struggling with it. And helping people to stop struggling with the thoughts and feelings they have is one of the most powerful things that you can do for people. But the third one is to help them become engaged, to be clear about what their values are, and to act in the service of their values. Not by getting rid of all the stuff that says they can't do it, by accepting the stuff that's there and moving forward because you choose to make your life about getting an education or about being loving to someone, even while you can feel angry or afraid of what they will do. You can choose to live your values, and you don't have to wait until your mind tells you, yes, you can do this. This is a partial list of the problems that have been shown to be affected by acceptance and commitment therapy. And one of the things that I think could be useful, oh, and by the way, this is also very valuable in helping people deal with stress. So it's not just helping your clients with these things, because you know how they teach this stuff? They teach it the same way that you'd be teaching it to a client. It's the same. We're all human beings. We all have this stuff going on in our heads, and we all want to live our valued lives, and so getting clearer on that is helpful to people who work in this field. It's helpful to their clients, and so it's relevant all around. So I would argue that there are two developmental pathways. Nurturing environments produce good self-regulation, and kids develop language and social skills, academic success, pro-social behavior, friendship formation, and you got at the adulthood compassionate, multiple skilled, resilient, and values-oriented folks. Or you can have non-nurturing environments that lead to aggressive and uncooperative behavior, academic failure, peer rejection, deviant peer group formation, early child rearing, drug abuse, depression, antisocial behavior, and don't forget cardiovascular disease. That's a choice. And in fact, to the extent that we can create those nurturing environments, we can have all of those outcomes and reduce all of these problems. So I come back to this slide. At every phase of development, you're concentrating on early childhood. There's good reason to concentrate on early childhood. But don't let the elementary schools, the middle schools, off the hook. Don't let the parents of kids at those ages off the hook. We need to provide supports for families throughout childhood and adolescence. And then there's the larger social system. We have the highest level of child poverty of any nation, and we've had it since about 1975. And that is a risk factor for everything. We also have the highest level of economic inequality. This is the US, highest level of economic inequality. This is an index of all the kinds of social problems we've been talking about and thinking about all day, and look at the relationship. The higher the inequality, the worse those problems. Finland, Norway, Sweden, and Japan, low levels of inequality, low levels of these problems. And by the way, they achieve it in different ways. The Scandinavian countries tax wealthy people. The Japanese never had the astronomically high amounts of money going to their CEOs and so on. But in any case, when you have less inequality, you have fewer problems. And by the way, inequality all hurts the wealthiest people. So if you're sitting there thinking, well, I'm rich, you know, if you're in an unequal society, there's higher levels, there's lower longevity among the wealthiest people in unequal societies. So then there's Robert Putnam's book, Our Kids. Have anybody heard of Robert Putnam's book? How many of you have read Nicholas Kristof's pieces about Yamhill County? Yeah. Actually, one of the things that I want to do is help to get a lot of media that's here, that's about Yamhill County, that can promote these kinds of things, including, I'll bet there isn't a person in this room who couldn't give you a 200-word description of something neat that they saw that happened with a client, with themselves, with their family, and so on. Imagine that there was a constant chatter of that sort about what's going on in the community. I think that could be very helpful. Robert Putnam's book is about, it's called Our Kids. And if there's one book that you're going to buy this year, it should be mine. But after that, you can buy Robert Putnam's book. He describes how over the past 50 years, America has become far less nurturing to those who are poorer. Economic inequality and poverty have increased greatly. Social mobility, the chance that a poor child will move out of poverty, has virtually disappeared. One of the reasons for that is that a safe, economically integrated neighborhoods and supportive social interactions just don't exist. The poor people live over here, the wealthier people live over here. He takes you to Port Clinton, Ohio, where he graduated high school in 1959. The guy's older than I am. And then he takes you back 50 years later, and it's like Back to the Future. I mean, it's unbelievable how it's just divided. Now there are gated communities on the lake, and the poor people live on this side, and they never interact. And so the poor people never come in contact with people who could actually help them and say, yeah, you can go to college and so on. Changing that is an important thing, and it may be relevant to housing because you need a mix of housing. I mean, when my parents divorced and we had to move to a third-floor walk-up, it was stressful. My rich aunt lived 3 blocks away. There wasn't that kind of segregation. So this is the child poverty rate in Yamhill County. As you can see, this is, I think, 2010, it jumped because of the recession. It jumped in Oregon. But, you know, there's 16%. That's enough that you should try and reduce that. In addition, there are numerous public policies that can reduce poverty, like the Earned Income Tax Credit, Medicaid coverage, supplemental security income, supplemental nutrition programs, unemployment insurance. We shouldn't have cut that off when we did. Indexing the minimum wage to inflation, housing subsidies, provide family interventions that have been shown to increase family economic security because they improve the chances for families. So translating all this into strengthening nurturance in Yamhill County. I would argue that we're all of us just trying to figure this out. An evidence-based program is the best bet, but it's not a guarantee. And no matter what its success, elsewhere, you know, it worked in Baltimore, wherever it worked, that's good, but we need to monitor its success here. It's sort of like Toyota had developed really good quality assurance procedures, and their cars are like 99.9% no defects, right? And they did that when they stole ideas from an American engineer back in the 1960s, and the American companies didn't, which is why the Japanese motor industry took over so much of the sales, because they made better cars. They lasted longer. In fact, here's my son's Toyota. We bought that in 1995, and about 2 weeks ago, he finally traded it in. That car lasted 21 years with very little problem because they monitored the quality of their manufacturing, and they kept doing it every year. They didn't say, well, you know, we had no defects this year, so we won't do that next year. The monitoring is part of the system that you need to ensure the well-being of kids, and so we need to do that. We need to, you're assessing kindergarten readiness. You need to assess how many kids have a medical home. Are the screenings occurring in early childhood? What are the outcomes of those screenings? Are there interventions when the problems are detected? The proportion of families being reached with effective interventions. Are there improvements in these measures over time? If there are, great. If there aren't, you know that you need to do something. And lack of improvement will guide course corrections. So if you think that I'm crazy, this is a slide of the tobacco prevalence in the United States. And by 2010, this is the rates of smoking for men and women, and by 2010, it just changed dramatically. If I were giving this talk 40 years ago, this room would have been filled with cigarette smoke, and I would have been one of the people smoking. The society has changed massively because of a relentless effort to educate people about the harm of cigarette smoking and to implement all of the policies and programs that would motivate people to quit, that would motivate people to support clean indoor air and so on. I submit that the things we're dealing with are more complicated, but they're not as complicated as every single one of these problems requires a different strategy, because every one of these problems is due to the fact that we have environments that fail to nurture development. And so I would argue that to the extent that we can come together around making sure that families, schools, neighborhoods, and workplaces are nurturing, by implementing the kinds of things I'm talking about, by getting policies implemented, by monitoring well-being, by making well-being a value of everyone in the community, that we can produce these kinds of changes just as we have done with tobacco control. The components of an effective prevention system, the first is a unifying and empirically supported vision of human well-being. The dominant vision of human well-being is the invisible hand. It's the free marketplace. If I greedily pursue my economic well-being, everyone will benefit. That's been the dominant view that's been espoused by many economists and many policymakers for the last 40 years. It wasn't true before about 1970. I submit that that's mistaken. Sometimes your pursuit of your own economic well-being will help. We have computers and cell phones and so on because of market competition. That's very useful. But ultimately, we have to evaluate that in terms of the degree to which it is beneficial. If you have the argument that it's necessarily good, well, you got to prove it. And I would argue that what we need to do is say, we value the well-being of every person, and we will support economic systems so long as they contribute to that. And when they don't contribute to it because we're marketing cigarettes to kids, we're marketing alcohol to kids, because we're allowing investment practices that lead to the 2008 recession, those are not benefiting people. There were 10,000 extra suicides in 2008 and 2009 associated with the recession. We need to evaluate all these things in terms of that, and we have the science to show what people need to thrive. You've been hearing about that all day, and so that needs to become our value. We need ongoing public education of these kinds of meetings. Policymakers, civic leaders, teachers, or parents, they're often not aware of what's possible. And we need ongoing public education campaigns that generate support for evidence-based interventions, that encourage people to be more nurturing in relationships with others, and that rebuild communitarian values. And we especially need a system of effective family supports, which you are in the process of constructing and expanding, and that's vital to the future of your communities. And you need positive behavior support in every school and preschool and childcare setting, and I've described a number of those kinds of things. But we also need policies that support development and prevent problems. I think public policy is vital to creating an environment that nurtures successful development and prevents common problems. Policies that say implement evidence-based programs. Policies that say we'll fund these things, but also policies that directly affect economic well-being. Last thing we need is a system for monitoring successful development. We need to be assessing at key developmental endpoints at birth, second birthday, kindergarten entry, 5th grade, 8th grade, and high school graduation. I want to particularly put in a pitch for the Oregon Healthy Teens and Wellness Surveys. They're done every other year, one of them versus the other, but they assess kids in 6th, 8th, and 11th grade. If we want to prevent drug abuse, antisocial behavior, cigarette smoking, and so on, we need to be assessing what proportion of our kids have those problems in 6th, 8th, and 11th grade. And that's it.